So, Namaskar everyone. My name is Dr. Manish Yadav. I'm a homeopathic consultant from Mumbai, and I welcome you all to my channel and especially to this playlist series where we are talking about Kent's. Already, a few lectures have been done about Kent's philosophy, and what are we doing is that we are trying to understand Kent in totality, especially in practical purpose. Like in practicality, how can I use Kent? And this journey has taken me to new discoveries and new insights into my practice. So the entire purpose of these videos that I'm doing is only to share the insights that I have gone through. And today I'm going to talk about something very important topic, and it's a very interesting topic. The topic says why cancer is incurable. We as a homeopath always attend lectures, seminars, and always we have lectures where we see good pathological cases being taken care, even cancers being, I will not say cure, but at least there is a lot of relief that we see. We see all the positive aspects of it in the lectures and seminars. But when you start your practice and you went in clinical practice, then you know where the shoe is pinching. And in practical aspect, really it is hard and challenging to treat cancers. Cancer is one section, but when I say cancer, I mean the entire pathological series, like all pathological conditions that we have. Now, treating a cancer, but when you think from a homeopathic perspective, nosology has no meaning. That is what our philosophy says. Philosophy does not talk about taking the name of the disease, treating the disease as per the name. So when we say we can treat cancer or we cannot treat cancer, we should not use the word cancer, but actually we should use the word in general aspect about pathological cases. So we have a lot of series, we have a lot of lectures, especially when I talk to my seniors and I get inspired seeing their cases and learning from them about how bad pathological cases have been cured or helped rather from homeopathic treatment. I'm into my practice since 2008. And if I'm not mistaken, around from 2011, I've been working with different masters with cancer cases. Now I have my own OPD. So it's been so many years, like 2026. So 14, 15 years of practice. So I always had this thing in my mind that a lot of patients come to me, a lot of patients I see, especially cancer patients, but also bad pathologies also. And there are many patients where the desired results are not there. And this I'm telling you openly. Like I don't know if many homeopaths will agree this or they will come out in on front camera and say this. We have a lot of challenges. And this challenge, I'm not talking about myself, but I've seen these challenges with my seniors also, with my teachers and gurus and masters. They have also struggled a lot in giving results in these cases. And I clearly remember when I was working with Dr. Sarkar sir, Sunilma Sarkar sir, one of my gurus and mentors with whom I've learned so much. In depth, I have my entire life, the great teachings and learnings from him. He would always say that, Manish, you know that Kent used to say that cancer is incurable. He used to always say that. Go and read. And he used to quote something from Matra Medica where Kent has talked negative, like, like cancer cannot be cured or we can do only this much help. He has written those things, right? He has written those things. And as I've been into this practice and I have managed so many bad cases. And it takes a lot of toll, when you manage these cases because you as a homeopath want to cure everything. You want to give relief to every patient. But that's not the scenario in every patient. And this always kept me in a loop. And always there was a question in me that with my so much great efforts also, why there are some cases where I'm actually not able to cure. So the question was whether problem is in me, my understanding, or there is problem in the disease itself. Maybe the disease is not to be cured. And as a homeopath, we always blame ourselves first. So I've also done that thing many a times. And that is good also, in fact, because once you keep doing that, that's how you grow. That's how you evolve your skills. You want to go and learn more and more. But definitely a time comes when even after so much effort, things are not happening. Then especially there has to come one word that's called wisdom. The wisdom has to come. And from where it will come? It will come from the master's teaching. So when I started this series of reading Kent's lesser writings, I came to a chapter, a very interesting chapter, where he says why cancer is incurable. And that's how he starts. So let us start with this. Let us start with this. And of course, the topic is why cancer is incurable. But I will say from homeopathic perspective, I hope you understand this, that when we say cancer, we are not talking about cancer disease. We are talking about bad pathological cases. For us, cancer means bad pathological cases, like, kidney failures are there, tuberculosis is there, where very bad tissue damages have been already done. So, in perspective, the word cancer will be taught, but you have to think in terms of entire pathological conditions that you're seeing. Maybe some kind of gangrene, some kind of, those cases where tissues are very much damaged. So, learning this thing, what I'm going to share today, this has helped me so much to, first of all, relax in my practice and to keep an eye on certain things which I'm looking for. Even in those bad cases, I know how much and how far to go there. I'm trying to understand that. With this entire series of Kent, and this, especially this chapter, has given me uh, a great insight into looking into the pathological condition and understanding and expecting what to do and what not. I think that is more important for a homeopath than to just stand and blame others, and and just talk, and don't give results. So let us go on this chapter and try to understand what is Kent trying to say. So the chapter's name I have kept is incurable cases. Of course, it starts with cancer, but I have said incurable cases. There are cases which are curable and there are cases which are incurable. So what is the perspective of Kent when he talks about incurable cases? The topic headline says like this: why is cancer incurable? Kent's lesson writing, page number 222. You can go and read and find out certain things in that. So let us start. When a case has been cured, why was it possible when other cases and most cases have resulted in failure? When you have 10 plus years of practice, you get many cases where cases get cured. And there are a lot of cases which do not get cured. So thinking doctor, thinker will always ask himself that the cases which get cured, why it got cured, and the other cases which are not getting cured, why it is resulting into failures. The reason has to be known. It is true that in some cases there are holdover symptoms enough to lead to a remedy. Holdover symptom means characteristic symptoms which will automatically lead you to a remedy. But in most cases, there is nothing. But in most cases, he says, there is nothing but the malignant growth and its associated features of hardness, stinging pain, ulceration, enlarged glands, and the tendency to involve the surrounding parts in its own development. If you have listened to my earlier talks, the other two videos of Kent, where he's talking about general symptoms, you will understand what he's trying to say. Kent always said that the pathology that happens, the tissue changes that happen, those changes, if you repertorize and you find out, this is Kent's perspective, that is not the remedy. He always said that along with that, of course, the pathology has to be taken into consideration, but along with that, there has to be some holdover symptoms, the characteristic general symptoms, which will differentiate the remedy. The causative factor, the modalities, those has to be there, mental generals. So that is how the idea came. We don't treat disease, we treat the person. So he says the most of the cases which are failures, where only the symptoms which are there are symptoms of disease. Hence, those turn into failures. What are the causes? Paucity of symptom. So number one cause he says about failure is that only pathological conditions symptoms are there, like malignant growth, singing pain, surrounding pressure area symptoms. Only tissue level changes symptoms are there. You cannot help in that case. Other is paucity of symptom. Many cases come where you are drilling, but there are no symptoms coming out. You go to different areas in his life, his generals, mentals, physical, everything, but there are no symptoms. So he says, if the child's mental symptoms could be fully ascertained and the symptoms from childhood to adult age, something might be done. So when there is a paucity of symptom, he says it is always better to go back into the past and try to ascertain. If like you're looking for a mental symptoms, like try to find out when he was a child, what were the symptoms coming up and which symptoms remained in adult age. General symptom, general mental symptom. For example, definitely we ask people, na, tell me about your childhood history. So some kind of fears, some kind of interest hobbies, some kind of trauma, those things which are stuck in childhood age till adult age, those symptoms have to be taken. So what idea I get from this is, okay, first let me finish this. He says, what he's trying to say is that, so when a patient comes and there is paucity of symptom, don't look to treat what you see. Tumor is there, gland is there involved, inflammation is there. Don't try to treat that. You have to go back into the past and find out. This is not what he's saying, but I'm just trying to make you understand certain things. It is very crucial for you to go into the past. Go into the past and find out from where the thing started. There has to be some chronology in the disease. Cancer you are seeing today, you cannot prescribe for cancer. Okay, there are rubrics, cancer tongue, cancer this, cancer. You cannot prescribe on that. Those are just palliative cares. If you really want to help, you have to go into the past and find out the evolution of disease, from where it started, till what age patient was absolutely fine. What was the first disease that affected him? What are the pathologies that is running into the case? This is what you have to understand. And even if you're looking for mental symptoms, what were the mental symptoms in the past? Which stage his disturbance started? And now when you read closely the remedies, if you read closely the remedies in Kent, you will understand that every remedy that is described, he is always talking about how the disease process starts. So one side, knowing these symptoms in the patient, like the idea has to be there that I have to go into the past and understand first from where the disease started. Evolution of disease. When was the first the patient got affected? What pathology or symptoms came? Even if you have to go into the past, personal history, or rather even past into the family history, from where it came. That is very important rather than treating the present, looking at the present totality. And we always talk about totality. We don't understand what totality we have to look for. Present totality is important, but today he's got such bad disease, from where it has started. So I was talking about the remedy. So one aspect is this understanding in the case history that you have to go into the past. And second thing, very important, is your mathematical understanding. Our mathematical understanding. It is so crucial. So what do we say about mathematics? When you read Kent, you read the remedy, any remedy you take, you will always get an evolution of disease. How disease forms in this remedy. There is always a process that Kent tries to describe in a remedy. You open colchicum, go and read colchicum. We know colchicum for gout and all those things, rheumatism and gout. But why? How does colchicum patient get disease? What happens? From where the suppression starts? Go and read colchicum today. You'll understand. Go and read bryonia. From where the disease starts? Go and read Conium, Carbo animalis. You'll understand exactly from where it starts, which constitution can produce that. So rather only repertorizing and only just asking and trying different advanced method will not help. So both sides has to be taken into consideration, and we have to work on our skills. Probably reading Mater Medica more in this fashion to understand the remedies, how disease is forming that. Okay, the cause. Cancer generally comes on in afterlife when childhood actions have been forgotten. I'm really sorry, there was little interference. So coming back, cancer. Cancer comes on in and after life when childhood actions have been forgotten. So I hope you understand now evolution of disease in the patient and also in the remedies. Learning Mater Medica. Again, I am saying learning Mater Medica properly is the key to your practice. The patient does not know her own childhood mental states. The parents may be dead. Sisters, brothers may describe the antics of the child. This is another problem. How many patients, how many individuals generally remember their childhood, exactly how it was? So this is another very big challenge, that even if you want to go in the past, sometimes these cardinal symptoms are not being extracted properly due to these hindrances or the blockages. Another issue is suppression. Now, what is suppression and how it affects in the case taking and deriving the data? Let's understand. History of old school drugging from childhood. Every childhood morbid condition has been suppressed. There is, like, an individual comes, adult comes, you go in the past, then you see so many acute diseases have been drugged. So many morbid conditions have been suppressed, either by medicine, by surgery, by harmful substances. And very dangerous is eruptions have been suppressed. Not only this era, but also in the family history also, you'll find eruption being suppressed. And many a times, patient do not remember that, oh, in a childhood I had some fungal infection, or I had some eruption, I applied this ointment. They forget. So when these external appearances are being suppressed, that creates a lot of problem. Symptoms have been changed by crude drugs. This is another big problem. When an allopathic or crude drugs are being given, many a times it is seen that symptoms are changed. So when symptoms are changed, and now how can you say the patient, when he's sitting in front of you, the symptoms that he's giving is actually the symptom of his real vital force? You have no idea. There could be an iatrogenic disease sitting in front of you. So the totality that we say, take totality. The totality that you're seeing and you're trying to evolve, analyze different systems you're trying to put. Let's try to understand the mind and this and that. So much theorizing you're doing. The entire basis can be just like clueless. You can be baseless. The entire facade it is like the symptoms that you're saying, maybe a drug symptoms. So when you find these things in the past, you will need to address these things. There are remedies for suppression. There are remedies. A lot of things are there. How to manage iatrogenic disease. We have certain things like that. No clear-cut representation of the constitution have been permitted to evolve. Because of suppression, the clear constitution has not come up, not evolved. So this is another thing. So this, why are we talking about this? Kent is saying because of these things, the symptoms do not come properly, hence cancer is incurable. So when we read this, it is also important for us to understand and go into the past and see what kind of suppressions have been done. And those things have to be addressed properly with the appropriate remedy. That is what I'm trying to say. Now when you see this, right? You just see this part. Just read this again. Now tell me, if you have not understood how the disease has traveled from childhood to the current age, how can you help that patient? And now you say, oh, I want to understand the mind. I want to understand this. Let's go deep into the totality. What a wrong path are we gaining? So all the methods that focus on theorizing, tabulizing, putting into table, classification, too much analysis of mental symptoms, too much digging into the mind. According to me, you will always land up into a wrong remedy because you have not understood the problem. The problem is not what you see. The problem is what you are not able to see right now. Suppose a patient comes to you. Patient comes to you with some pathology, maybe liver there is abscess or anything like creatinine is high, maybe ulcer in the stomach. You have to address it. Now you have to find out why that ulcer formed. Before ulcer, what were the diseases that he suffered? You don't understand the chronology of disease. How can you help it? And in that chronology of disease, how many suppressions have been done? What kind of suppressions have been done? If you are not able to understand that, you have not understood the problem. And if you don't understand the problem, how can I give solution? So that is why homeopaths fail. Because you are doing with your best effort, but you're walking on a wrong path. If the symptoms that have appeared from birth to the present date are undiscovered, it is no wonder that cancer is incurable. See what he says. Whatever may be the reason, paucity of symptom is there, suppression is there, physician's skills are not proper, whatever is there. But if you can't address or find out symptom from birth to present date, if you're not trained properly to go into the past and get exactly what happened in the past and try to understand and unfold the series of diseases and affections and all the conditions that were in the past, no wonder cancer is incurable. When we say cancer, we are saying about the entire pathological condition that you're seeing. It is not just cancer. Please remember that. We do not know whether the child was obstinate, hateful, ungovernable, hysterical, violent, slow in schoolwork, or the opposite. We can learn only the commonest features of puberty, which is the most important time to investigate in all women. He says one more feature he adds that it is very important. We can learn only the commonest features of puberty, which is most important time to investigate in all women. Puberty is such an important part of female's life. All the four stages, puberty, lactation, pregnancy, and menopause, and every month's monthly cycle. These are stages where changes happen, the hormone changes happen. So you have to understand what happened in puberty, how things went wrong. To cure any condition, we must base the prescription on the totality of signs and symptoms and not on the pathology. That is why I have written this in bold. To cure any condition, we must base the prescription not on the totality of signs and symptoms. Like we have to base the, on totality of signs and symptoms, not on the pathology. So please be careful what totality you take. Yeah, totality, we have to take totality, but what totality? Please see that you're not just taking the disease totality. You have to take the cardinal symptom, the general symptoms. the cancer is ultimate. He says very nicely, the cancer is ultimate. The symptoms from first are the outward image of the patient. Says symptoms are the first outward image of the patient. The internal disturbance, Handman says in organ, the internal disturbance, how does it manifest? How an intelligent physician know about the disease? It is through signs and symptoms, especially symptoms. If they have been suppressed or changed by the drugs that are not homeopathic, then there is nothing left for a homeopath to do, and surgeons can do no better also. So how nicely he says. So symptoms of the disease, body is always trying to throw out the symptoms to show the internal disturbance. If you can find out those symptoms, and for that you have to go into the past and try to understand. I've already told about that. If they have been suppressed or changed by the drugs, and by your hardest effort or your best skills, you're not able to explore that or understand that, or it's not there only, right? It's been so much suppressed. We as a homeopath can do nothing in those cases. And of course, even surgeons can do nothing in that. They can just operate, but the patient is not going to survive. So here our question comes. I think the question comes in the mind that if I'm treating a case and I'm not able to get the outward image of the symptom and only disease symptoms are there, then what to do? And that is why Kent's 12 observation is there. And now here comes, now I'm adding from my side. Now here comes, in these stages comes the importance of those other methods that we have. Use of mother tinctures, use of iatrogenic drugs, use of tautopathy, use of nosodes. We have to understand this. We have to understand this. That is why understanding Burnett is very important. Understanding Boger's concept is very important. Knowing about the smaller remedies from Boric is very important. Because in those conditions where the cardinal general symptoms are not there, like suppose somebody is Kantinian philosopher. According to Kent, things have ended now. Now you can do nothing there. But if you are somebody who wants to extend and you want to do something more, I think understanding pathological remedies, understanding bogus concept, I talked about all those things, no source, tautopathies, these things will help. And I think Burnett is the one. After you finish Kent, the another person that you should read and understand is Burnett. If you are really keen to understand and treat pathological conditions, how to change the remedy, how to intervene with pathological remedy, all those aspects are there. And when you do that, slowly and steadily, gradually, you help the vital force to become stronger enough, and then ultimately it starts throwing out the symptoms. And when it starts throwing out the symptoms of individuality, then you are on the right track. But in many cases, maybe that individuality is not there. Hence, you need to use those other methods. So a real homeopath, I feel, is the one who has to understand both aspects. This is what I feel. You have to understand the Kantian approach. First is the classical method, Kantian approach. But where you are stuck in those cases, this thing has happened, then it is very important for you to understand the Burnett's method. I'm just summarizing that Burnett method. Everything comes there. Already I've made a lot of lectures on, a lot of videos on Burnett. You can go and watch, you can start reading. Okay. So let's get back. So hence it is said that Kent always says cancer is incurable, because he knows that when a patient comes in that condition, there is nothing to prescribe. And even after using the best of the best things, sometimes we are not able to help. This is the reason. So this topic actually gave me a wisdom. When I was reading this topic, it gave me a wisdom. Now I know in which cases how far I can go, what best things I can do at that time. Palliation or prolonging life are not cure, he says. So when we say cure, palliation is not I have prolonged the life. That is not cure. But yes, many times the damage is so much happened already. It is not that you are a culprit. Like, already the damage has happened with the patient and his lifelong treatment in childhood or even the past history. Maybe in those cases, only palliation and prolonging life can be done. That is why it is very important for you to keep Kent's 12 observation on your side. That will help you to understand which cases can be cured, which cases can be palliated. Then you know, once you know, then you can act accordingly. That's what I'm trying to make a point here. You have no idea. You are just expecting things to be cured. But maybe the case is such that it cannot be cured. All curable diseases make themselves known to intelligent physicians in signs and symptoms. Enemy. So if signs and symptoms are absent, we don't know how to cure. Period. Pathological condition, as also the patient, are incurable when there are no signs and symptoms, and so long as there are no signs and symptoms, these remain incurable. This is the definition of incurable. And this does not pertain only to pathological condition. It can be even to the functional condition. For example, somebody with minor allergic rhinitis comes, cough comes. If there are no good cardinal symptoms, signs and symptoms, that case also can be incurable. So you have to change the remedy, you have to do something, and you have to wait for the right time when the signs symptoms come. We have to stimulate the vital force sometimes with so many other remedies that we have. In proportion as the pathology progresses, the signs and symptoms decrease. Understand this part. Read this again. Sorry. We're saying as the pathology is progressing slowly, it is engulfing the entire economy. And gradually the sign symptoms go down, go down, go down, go down. And you have only the pathological symptoms. Hence, it is very important that when a patient comes with a pathology, it is very important for you to go into the past. Because when the disease process started 5 years before, 10 years before, in the first disease that he got affected, there were signs and symptoms. Like I'll give you an example. Suppose you're seeing a patient today of some neurological condition. You can repertorize, you can find out some organopathic remedy, pathological remedy, some nose note. You can do all those things. Protopathy, you can do because that's what you can do at the best if there are no symptoms. But that is not cure. You are just palliating. That patient will get cured only when you go into the past. Suppose you go into the past and you understand that this patient had got malaria. Many times she suffered from malaria. You go and take the malaria symptoms if she remembers. And beautifully, when you take the symptoms, you get China. So that patient's remedy is China, not what the neurological condition suggests. So, fifth aphorism, keep that thing in your mind. In acute, exciting cause and in chronic, fundamental cause. So you have to go into the past. Suppose somebody is coming and now you're not able to understand, but pathology, the symptoms are vague and not right remedies coming. Go into the past and see. The patient says, I have severe migraine since 20 years. Just go and totality find out about migraine. The remedy to migraine may be the remedy for the patient. Right? Once the series is ended, I will also put many cases, many chronic cases also, where I will talk about these aspects. And through cases, I will try to make you understand. This is marked in cancer, tuberculosis, diabetes, and bright disease, and many more. and in all organic conditions of the body. I told you before that this lecture is not just cancer. It is of all organic condition of the body. So remember, when you're saying, suppose you're saying kidney disease, right now, of course, we have to use some pathological remedies, some organopathic remedies, we can use for temporary purpose, palliation and things like that. But the real cure, even if it can happen only going to the past. Okay. In some instances, the remedy that was once indicated by mental and physical symptoms will cure even the moderate advanced pathological condition. Says in some instances, the remedy that was once indicated by mental and physical symptom will cure even moderate pathological conditions. Again, such a remedy will soon reveal that the patient has been sick too long and the pathology has progressed too far. The reaction is so feeble that he sinks rapidly. he says that when pathology develops, as he said, pathology develops, sign symptom go down. Maybe in this condition, you can go into the past and find out some mental generals and physical symptoms. Maybe that can help in some condition. But he says sometimes the pathology has taken too much control of the economy that gradually patient is becoming sick because pathology has developed today, but patient is sick 10 years before, 5 years before. So now pathology is progressing, and then the reaction of the vital force goes down, and the patient is sinking even with the right remedy. The remedy must be antidoted. Right remedy can also cause aggravation, you know that. It can kill also. I hope you know that. Because when the pathology develops, the vital force reaction goes down. So when you give right remedy, sometimes it can cause a lot of trouble also. Because the pathology has taken completely charge of it. So even with the right remedy also, sometimes the patient is incurable. How do you know the reaction of the remedy? The remedy reaction will tell you exactly whether the patient is going to live, die, or cure, or palliate, or whatever. Hence, again, I'm saying you Kent's-Well observation. You have to study Kent's-Well observation and match it in all your follow-ups. That will help you to make you understand how far we can go, how far we can go. Cases needed to be antidoted. He gives an example. Sorry. I remember a patient who had long suffered from tuberculosis of lungs. Cavities were present, several hemorrhages had occurred. The mental and physical symptom had called for phosphorus from the early history. And even at the time he came, this remedy fitted the symptoms. So this is ideal that we are talking about. Phosphorus was given high potency as I had not learned better, and there followed high fever, involuntary diarrhea, and sinking. It was apparent that this patient would die, but arsenic antidoted and the overreaction of phosphorus, and the patient lived for several months. Ultimately, he died. So learning there's a one word called vitality. You have to understand what is the vitality of the patient. Now, pathological condition as there, now patient is sitting in front of you, how good the vitality is. If the vitality is low, susceptibility is low, you cannot give high potencies. And that is why people say when there is a lot of great pathologies, you should avoid giving high potency because it can cause a lot of aggravation. But you'll say that we have seen a lot of condition where in pathologies, high potencies till 10 mcm has been given and with good results. Yes. Only in those cases where the body's vitality was good. And that is why some physicians use 30, 200, 1 gradually and they increase the potency. The entire game is of vitality. So if vitality is low down, very low, even if you get a very good remedy, like in this case, past history, the mental, physical, everything matching, even the present totality is matching, you give, the patient will deteriorate. Here I remember one case. There's a book called Erastus Eli. Cases. The name of the book is Cases, Erastus Eli. This book was given to me by Dr. Sarkar. And there's a case in the Lacasis chapter. There's one case, sarcoma, neck sarcoma of a girl. Wonderful case, wonderful case. The entire case, every follow-up, he has described this happened, then this happened, this wrong remedy, wrong remedy. You can learn so many things. If you get time and if you have access, please go and read. Erastus like cases, Lacasis chapter, sarcoma, young girl. Maybe later I will also try to put that case on my channel. But if you have software or you have the book, you can go and read. The patient must have the reactive ability when the similar remedy is administered or become worse after that such remedy than before. So how is the reactive ability? What is the vitality of the patient? So please keep that thing in your mind. How can I know that my patient is going to be cured? This is a very important question. Okay, I understood so many things about incurability, but how do I know my patient is going to be cured or not? Of course, one of the things is your Kent's-Well observation, but yes, he says it is the homeopathic remedy only when the patient can react from it. Otherwise, it is only a similar agent and not a remedy. So how will I know my patient is getting cured or not? When I give a remedy, how well he reacts to it. Otherwise, it is just a similar agent, not a remedy. All similar remedies, read this properly. All similar remedies is not a homeopathic remedy. All similar remedy is not a homeopathic remedy. Get this sink in your mind. The remedy can be similar. It can affect partially. But it is only homeopathic. The remedy is only homeopathic when it has produced some reaction in the patient. It is never such when patient lacks that reaction, which is always dependent on, so promptly noticed in all curable cases. So that lack of reaction, in curable cases, lack of reaction is not seen. You will see good reaction after the remedy. Some patients have lost this reaction when there is no visible or discoverable organic disease. So even if organic disease is not there, even in such cases also possibilities that they have lost this reaction. That is what comes to the aged who die of senile debility. And it may be said as a fact that disease has no disease. Like in old age, gradually you'll see the patient is deteriorating gradually. You have to be very careful not to give the right remedy to these kinds of patients. You have to use superficial remedy, not the deepest remedy, that acting remedy. Because their reaction is not good enough. So patient dies, with no disease. You ask what happened? No, old age, because of old age he died. But something was happening, right? But there was no disease. The disease had no disease. We often see in the last days of aged a quick response after the remedy, but it holds only few hours and he sinks his final rest. So there are remedy reactions in Kent's-Well observation when if you give a remedy and quick amelioration followed by intense aggravation. So he writes down these cases are incurable. Quite similar is this lack of reaction in some feeble, young and middle-aged people. Where it comes from constitutional debility or pathological condition, the lack of vital force is this, lack of vital reaction is the same. So we are talking about old age, but when the same condition, the same reaction you see in patient who is constitutional debility is there or pathological conditions are there, the same scenario you have to understand the same thing is happening there. So you have to be careful. When we think of curability of cancer, tuberculosis, this is the question to be considered. This is the condition to be questioned. What condition? What question? Sorry, this is the question to be considered. What question? The vitality. How good is the vitality of the patient? That is also one of the factors how well you can go about in the case, and what remedy actually you have to use in. How can judge the measure of this reaction? How can judge the measure of his reaction? How can we judge? So long as signs and symptoms are present, good vital reaction continues. Simple. Again, he talks about the same thing. Good signs and symptoms are there, good vital reaction. After the signs and symptoms have departed, the pathology has taken their place. It is impossible to predict what the quality of his reaction may be. Until the patient has been tested by a similar agent. When this is known, it will be easy to understand why old symptoms return in chronic cases after administration of the similar remedy. If the vitality is good, then only old symptoms will come back. If vitality is not good, the patient's symptoms are not going to come back. What an amazing writing this is. Amazing writing. This gives you so much wisdom to understand, not look patient only in signs and symptoms, but also try to understand the vitality, the pathology, and you know how far you can go. So patients having feeble reaction are only palliated, while those of strong reaction go through all the past symptoms in reverse order of appearance. So when the feeble reaction is there, I know that I can only palliate this patient. The best thing that I can do is only palliate. So I am clear with my mind. Then I will not give false hope to that patient. When reaction is good and past symptoms are coming, then I know, yes, I'm on the right track. So it is not this only homeopath and homeopathic remedy that will cure. It is also the patient's economy. Both things will contribute for the cure. So people who claim, homeopaths who claim, we treat pathologies, we treat big disease, they should also talk about these factors, because every homeopathic doctor, students should know these factors. They should have another intelligence to understand these things in the case, which will gradually come. But yes, everybody has to talk about it. In patients with cancer or tuberculosis, we may be quite certain of their ultimate recovery if, very nicely said, all symptoms return after administration of remedy. So your question is how to know my reaction is good or not, patient's reaction after remedy? All symptoms have to come back. That is why some school of thought focus so much on Herring's law of cure, Herring's law of cure, Herring's law of cure. They want to get all the old symptoms in every patient, but it is not possible, my dear friends. The old symptoms will come. Of course, the right remedy has to be, you have to choose, but even after right remedy you have chosen, still old symptoms cannot come if the patient's vitality is low and the pathology is completely taken over the economy. So don't be fanatic about Herring's law of cure. Those are guidelines that helps you to evolve and look deeper into it. Don't get a fanatic. Not every case is going to give you Herring's law of cure. But yes, when old symptoms are coming back, you should be happy that yes, now the patient is on track. It is not, don't take your credit. Oh, I gave such a good remedy. No. It is patient's vitality also. Maybe in another case, your remedy was right, your efforts were right, but the vitality was not good enough. So it is both, through both hands, both ways, when come together, then only the cure will happen. From patient's vitality point of view and your remedy selection. These patients seldom have vital reactions strong enough to develop former symptoms, and they are incurable. So not all patients will give you Herring's law of cure or old symptom coming back. Their vital reaction itself is low down because the pathology is completely engulfed the economy. Maybe the symptoms will not come back. And when symptoms are not coming back, you should understand that yes, these cases are incurable. Yes, I can help them for some time. I can palliate, I can prolong life. So you are clear with your agenda, like you know what best I can do in this case. To be able to perceive the remedy, to be able to perceive the remedy from signs and symptoms in present or past history is one of the item of cure. Make this point very important. But another and quite different item is, so one of the thing is that I have to understand signs and symptoms in the present and the past. But another quite different thing is the vital reaction of the patient. It is also the vital reaction of the patient. When both things will collaborate properly, then only cure will happen. Otherwise, cure will not happen. To find the remedy that will restore the lost, he says, to find a remedy that will restore his lost vital reaction is thus far impossible. You can ask, tell me some remedy where we can give and the vital reaction comes back. No. He says, vital reaction once gone completely, it cannot come back. You can just help that patient palliate. That's it. And he says, even surgeon's knife in these cases are failure. So this will make sense when you understand that the disease that you're seeing is not the real disease, but the disease is evolving through past history, through family history. We already spoke about all those things. And it is very crucial in your case taking to take past history, family history properly. You have to take family history, past history properly, evolution of disease properly. So when you evolution of disease, the past symptoms, the stages when the disease started, the age when the disease started, the family history, the exposures, the occupation hazards, the lifestyle, those things had to be taken into consideration. Once you take those into consideration, then you make the totality. That totality is the real totality. Those signs and symptoms are the real. Right? And of course, second thing is the vitality of the patient. So, understand Kent philosophy properly and understand the Burning's philosophy. I would recommend that again. This will help you. When you understand both the things, you know when to use what. When to use what. In fact, both things can be used together in these cases. As the remedy unfolds, you will need different things. But I might give you all the what do you say? All the weapons, right? But when to use what weapon, that is the intelligence. And for that, we have to read, we have to study, we have to listen to some people who are really clinicians and doing some work. We have to look into the cases, not just go into the philosophies, all theorizing, charts and tables. No. Less theorization, less theorization. Homeopathy, my friends, is very simple. Read your mathematica properly, look into your clinical cases, and read your philosophies, read your lesser writings. You will gain a lot of wisdom through it. And then the questions will arise, and those questions you need to ask to the people. We have no questions because we have not read properly anything. So anybody comes and says anything, we just become fan of it. And you don't evaluate the cases that we are seeing. We have to question the cases that we are seeing. Somebody comes and teaches, and I tell them, look at the cases, look at the reports before and after. Ask everything about the case, not just, oh, wow, I got such a great remedy. No, because remedy itself is not just important. The results are important, and to understand till what level we can help. So I'm done with this. This entire lecture is being recorded. You can watch it again and again if you want. And if you have any question, you can write down in the comment. I will try to answer. I'll come back with more such lectures where talking about practical aspects of clinical practice, we are going to discuss. Thank you very much. Bye-bye.